Good morning, everyone. Thank you for being here with us. Thank you, Governor. Thank you, Secretary Pryor. Always a pleasure. And welcome to Tom McCarthy, our Executive Director of the Rhode Island COVID response team. He's joined the team and fit in wonderfully, helping to make sure that we can continue the efforts pushing forward operationally and working strong together. As I've done for the last few weeks, I'm able to stand here today and say that our data picture for Rhode Island continues to be a good one. Our statewide positivity rate continues to hover around 2%, as it has for the last month. That's huge and a great credit to all of you, because we're all contributing to this together. 2 weeks ago, we did see a small bump in our case count, but we have seen that number starting to fall again. It has kind of held steady as opposed to continuing to increase. There are some communities, however, that we are watching the data carefully in because of the question of whether or not there are some increases. That includes South Kingston, North Kingston, Smithfield, Woonsocket, and Portsmouth. But overall, our municipal case rates are still trending in a good direction. For me, one of the best pieces of news is the situation in our nursing homes. Over the last 2 weeks, we have identified 9 new resident cases in nursing homes. And it's important to say because that is exceedingly low. To give you some context, there was a 2-week span in November when we identified more than 475 new cases among nursing home residents. And over these last 2 weeks, it's been 9. Hospitalizations and fatalities among older adults have fallen off significantly as well. As good as these data improvements are, I really want to reiterate what the governor has said and what we all have to stay focused on, how important it is for us to continue the basics that we know. We're not out of the woods yet. We're going in the right direction, but it is critical that we continue mask wearing, that we continue social distancing, we continue washing our hands regularly, that we continue getting tested regularly, getting treated for COVID-19 if you test positive and qualify, and very importantly, that we continue staying home when you feel sick. Everyone across the board in Rhode Island is very hopeful about how amazing our summer can look. We are positioned to get there. We need to continue to take the steps together so that we can reach it effectively. We really need to remain focused, especially now, especially as we start to make some of the restriction changes that the governor referenced and that our Secretary Pryor is going to go into more detail shortly on. So please keep wearing your mask, particularly in all of our public settings. It's still the rule here in Rhode Island, and the reason is because we are seeing time and time again how effective masks are at infection prevention, at keeping COVID contained. We want to stay at that 2% mark even as restrictions are opening. That's an ideal goal. We have a team at the Rhode Island Department of Health monitoring the COVID-19 coronavirus variant situation, including people from our state health laboratories at RIDO, our modeling and data and analytics team, our testing and our case investigation contact tracing units, among other areas. Our high density communities team, all are engaged in making sure we have our hands wrapped around the best attack strategies we can put in place for combating the variant as it's continuing to spread. What we are seeing locally and nationally is that even with these more contagious variants, masks work. That's a #1 takeaway. Masks prevent the spread of respiratory droplets, which means that they prevent the spread of disease, particularly when it's a disease that's significantly more contagious, or a virus that's significantly more contagious than the version of the virus that we have been dealing with through most of the pandemic. So in particular, please make sure that you're wearing a high-quality mask, and make sure that you're wearing your mask correctly. Your mask should fit snugly but comfortably over your nose, mouth, and chin without any gaps. KN95 masks are great, but another very good option is also a cloth mask made of a tightly woven, breathable fabric that's at least 2 layers thick. For more information, go to covid.ri.gov and click on COVID-19 prevention to see what you can continue to do for yourselves and to protect your household. To transition for a moment to our vaccination campaign, as the governor said, we are making very strong progress. We have now administered roughly 350,000 doses of COVID-19 vaccine, and 10% of Rhode Islanders are fully vaccinated. We're administering roughly 7,500 doses a day, and we are in the top 10 nationally for first doses administered per 100,000 residents. Hopefully that gives you the confidence. We knew what we set out to do with phase 1. We achieved the nation-leading drop in hospitalization, the fastest and the most significantly. And then as planned, we shifted to our approach with phase 2, and we are now ranked in the top 10 for doses administered. Cities and towns are hitting the ground running on the governor's plan to get all teachers, school staff, and child care workers vaccinated with at least 1 dose by the end of the month. And as the governor shared, we opened eligibility today to Rhode Islanders who are 60 to 64 years of age and Rhode Islanders with specific underlying health conditions. These health conditions include diabetes, type 1 or type 2, lung disease such as COPD, emphysema and cystic fibrosis, heart disease, and kidney disease. People aged 16 to 64 are also eligible if they have a weakened immune system. That includes people who have cancer, people who get chemotherapy or radiation, people who have HIV or AIDS, people who have sickle cell disease, people who take medicine that weakens the immune system, and people who are pregnant. While we are very excited about taking this next step, it is important to know that not everyone is going to get an appointment on day 1. Our vaccine supply is still limited, though we are encouraged that that will start to change over the next several weeks, given Biden's announcement. There are more than 70,000 Rhode Islanders between 60 to 64 years of age and another 85,000 people with underlying conditions as rough estimates. We are asking people to please be patient early on. We will get there with time, but we are definitely starting slowly, solely because of the small vaccine supply. In addition to opening eligibility for these 2 groups, we have also been doing a lot of work and planning and implementation around getting vaccine to people who cannot get to a clinic. I have spoken at previous press conferences about how we've been gathering information for people in this situation so that we know who you are and can reach you if you are one of the individuals who are homebound and cannot get out to a clinic. Some agencies in Rhode Island have started to do some limited vaccinating of Rhode Islanders who cannot get out to a clinic, And we are currently finalizing contracts so that we can partner with 3 different vendors to perform in-home vaccinations. We are hopeful that they'll be able to start reaching out and scheduling appointments with people next week. Access is a priority for us. Equity is a priority for us. We are going to make sure that everyone who wants to get vaccinated eventually will be able to get vaccinated. And we recognize fully that we have a lot of work to do, particularly in our communities that are hardest hit with higher hospitalization rates and disproportionately lower vaccination rates. We fully intend and have a plan in place to ramp up and make sure that we close that gap. There is work to do. While we don't yet have all the vaccine we want, it is important to know there are 3 elements that are going to bring us home with this. It's vaccines, it's testing, and it's treatment. We do have plenty of treatment. As a reminder, we have a safe, effective treatment for people who have COVID-19. If you test positive for COVID-19, and especially if you are 65 years of age and older or have an underlying health condition of any age, talk to your doctor, talk to a doctor. If you don't have your own doctor, treatment is still available for you. If you don't have insurance, treatment is available for you. No matter what, we want to make sure that everyone who can accesses treatment because it works in terms of keeping people out of the hospital and keeping people alive, similar to the way vaccines do. To learn more, visit covid.ri.gov/treatment. I've talked about vaccinations, I've talked about treatment. That last key component of our response right now is testing. Treatment is critical, and so is testing so that we can identify who needs access to that treatment. As we make the incremental changes that the governor has described, testing is more important than ever. As we are loosening restrictions, it's even more important to get involved in getting tested regularly. We have the capacity in Rhode Island for everyone to get tested weekly. Please take advantage of that. Even if vaccinated, even if people around you are vaccinated, we want to continue through this final stretch until all Rhode Islanders are vaccinated, that testing is available, and we want you to get tested regularly, weekly, as often as you can. It's fast, it's free, and it's easy. Go to portal.ri.gov to make a same-day appointment. Before wrapping up, I want to provide the same reminder that I did last week about the serology testing that we are doing. Serology testing looks for proteins in the blood called antibodies. Antibodies are produced by the body in response to the presence of a virus such as coronavirus. Serology testing gives us information about whether someone was previously exposed to coronavirus that causes COVID-19. We sent out letters to 10,000 randomly selected households about getting tested. Testing is still available through March 19th. To get antibody tested, it's still available. We've extended the deadline a week so that everyone who we have reached out to can respond and take advantage of this opportunity. If you get a letter, we're asking you to please consider taking part in this study. This kind of information is so important for the planning we're doing around COVID-19 here in Rhode Island.